When it comes to your doctor, you tell them everything they need to know to make decisions that protect your health. But what happens when doctors are keeping their own secrets, ones that could impact their practice?
It does not take a lot of thought or brains to figure out that an impaired doctor practicing medicine poses a risk to their patients.
Yet it's a real risk faced by patients across the country. Researchers estimate 1 in 10 physicians will struggle with drug or alcohol abuse at some point in their career. And a recent survey discovered 14% of doctors admitted to drinking alcohol or using controlled substances at work, with experts saying the stress of the profession and the access to prescriptions putting doctors in a unique position.
Despite the fact that we might like to think of them as superheroes, they get sick like everybody else. And when they do, the option for therapy and treatment should be available to them just like any other patient.
In almost every state in D.C., specific treatment for addicted doctors is handled by something known as a physician health program, or PHP. They're not physical detox or rehab facilities, but rather specialized treatment, monitoring, and oversight plans often run by state organizations, working to get physicians the help they need to hopefully return to practice. But those programs are largely secretive. A doctor's enrollment is not shared publicly, no matter how severe the reason they've ended up in the PHP. Our national investigative team spent the last 2 months digging in to see how it all works. We discovered a system that supporters say gives doctors a confidential alternative to discipline while still guarding public safety. But critics argue it puts the protection of doctor reputations ahead of a patient's right to know.
I feel like they do have the right to know because they have the power to change your health outcomes.
Julie Pace has seen behind the curtain of the PHP system and came to us with concerns about the secrecy of the program and how it impacts the public. She was married to a doctor in recovery for substance abuse. It was this man, Dr. James Michael Pace, who we found behind his desk at his solo practice in Mississippi. He wouldn't speak with us then and didn't respond to specific questions sent in 4 emails in the last 2 months. But documents supplied to us by his former wife pull back the curtain on the PHP process.
If people look at Dr. Pace's record, what do they see?
Nothing. Clean slate.
That's not what's in the public paper trail, although Dr. Pace is not the one responsible for hiding it. The program is confidential. But records Julie provided show he was first enrolled in his state's PHP in 2003. Pace has signed several program contracts since then, agreeing to abstain completely from alcohol and mood-altering substances, or risk being immediately reported to the Mississippi Medical Board for discipline. But court records show Dr. Pace relapsed and had 2 lengthy stays in rehab in 2018 and 2020, although there's no indication he was ever impaired at work or had patient complaints. It appears Pace didn't practice medicine for a period of time and even testified he had to reapply for his license at one point. But you won't find any of that on his public profile on the medical board website.
I believe everybody deserves second chances, don't get me wrong, and no one's perfect. But a pattern of behavior is a definite cause for concern. They should know about that. I would want to know. There should be some transparency. There should be accountability.
There's no reporting listed, no discipline, and no change in his status. Although we did uncover tax filings that show Dr. Pace served on his PHP's board and even acted as the associate medical director before he relapsed in 2018. His case is just one example of what can happen behind the scenes, with little showing up in the public record that patients can access. Even basic statistics are hard to come by in this system where confidentiality is a core value. Since PHPs don't disclose information, our team went state by state, asking medical boards how many doctors they've sent to health programs. Only 22 would provide information. We ultimately discovered at least 1,000 physicians from those states have been referred to PHPs by their medical board since the start of 2020. Including doctors whose public board discipline records show have been charged with DUI on the way to work, some testing positive for drugs, slurring and stumbling on the job, even admitting to drinking daily while working with patients.
It is a major problem.
It's a problem Dr. Sidney Wolf with the consumer advocacy group Public Citizen says needs to be addressed with patient concerns put first.
At what point do you believe the public has a right to know?
Since you're placing your health and life in their hands, they should know as much as possible. It is not an intrusion on the doctor to let the patient know that this is what they did.
But our nationwide look at PHPs shows the identities of physicians are zealously protected in these confidential programs, with written permission often needed from the doctors being treated to release any information, even when they're being routinely drug screened, monitored, and practicing with a list of conditions following treatment. And as many of their websites show, the PHPs often have no obligation and won't always report to the medical board when doctors don't follow the rules, unless there's an immediate threat to safety or specific patient harm.
Why wait until someone has been harmed? The imminent danger almost always means someone's been harmed, damaged, or killed in some cases because you didn't catch them earlier on. So why are the rehab organizations not automatically notifying a medical board? And that's because the state medical associations don't like the idea.
State medical associations, or societies, as Wolf points out, are doctor-funded lobbying organizations that play a powerful role in shaping the policies that determine how physicians are licensed, monitored, and policed. Our investigation discovered those groups run or have links to at least 17 of the PHPs across the nation.
And the rehab programs are not going to be likely to do something that will offend the doctors, namely report the progress or the existence of a doctor licensed in that state in a rehab program. They're not going to like that.
If your physician is at a point where they're being drug screened and supervised, he believes the public has a right to know at that point. Do you agree or disagree?
Yeah, I would disagree.
Why?
Just because I think on balance that will discourage individuals from seeking care and treatment and will put the public at greater risk.
Dr. Chris Bundy is the executive medical director of Washington's PHP and the immediate past president of the Federation of State Physician Health Programs. He says without a confidential option to seek treatment, sick doctors may stay underground and keep practicing until their illness progresses to actual impairment on the job.
And you have to understand that one of the primary motivations for individuals to engage in these programs and remain compliant with the program is that they know that if they're not, confidentiality will be lost. So that confidentiality is actually a powerful motivator for the compliance that we see in the program.
The programs, Bundy says, yield gold standard results when doctors dealing with substance abuse participate and are monitored by PHPs. Studies show abstinence rates approaching 90% at the end of 5 years. But when there is a failure, Bundy says that doesn't automatically mean a doctor has put patients at risk.
It just means that they haven't complied with the terms of the agreement. But again, illness does not equal impairment. I think overall, the system has supported the idea that these confidential programs ultimately benefit patients and patient safety.
But people like Julie Pace say doctors still reap the greatest benefit from the lack of transparency in the system.
When all of this happens behind closed doors, what does it do to the public's trust in the medical industry?
Total distrust. Yeah, they don't really trust anything. They're putting their health in your hands, basically, to make decisions for them. They should have the right to know if you've struggled with anything, I feel like. And then they can make their own decision if they want to continue to see you or not.